Medicare for all. This Medicare for all will replace all of other health insurance. So if you have any other health insurance, then this will replace it no matter what type of insurance it is. Medicare for all is more generous than your own Medicare programs. So it's better in a way than most of our own Medicare programs. Medicare, you sometimes have to pay some, but with Medicare for all, it would cover medical bills with no financial burden on the patient. So this will leave a lot of people more comfortable to go to the hospital and get treated for the things they need, knowing that they won't be charged an outrageous price and something that they can't pay back to the hospital, or they won't have a bill after. This is a pro to all who can't afford to be paying doctors and hospitals back also. This will cover everyone living in the United States. That means everyone. This will pay for vision and dental care, prescription drugs, and mental care. So this would pay for everything medical. Another good thing about this is that there will be no copays or any deductibles. So those outrageous prices and things that bills that we have to pay after hospital visits will be cut down, and some won't have any at all. Medicare for all is a popular proposal to expand healthcare access in the world. The Medicare Act for All will provide health care to everyone, every woman, man, and child in the country. Only in our country, though, without any of out-of-pocket expenses. This would allow everyone to get the health care that they need when they need it. I feel like this is good because some people won't go just because of the price, like I said before, and now people will now go and get the help that they need. The good news about Medicare for all is that bills will generally build on the current provider system, so that doctors and hospitals that already accept Medicare could likely continue. Medicare would be a big chance. Bernie Sanders' proposal will set up a new government health insurance system. This will have many more benefits than Medicare. So Medicare for all will have more benefits than Medicare itself. Everyone will get health insurance from this new government system. Me personally, I honestly think that this is a good idea for some, especially those who cannot afford expensive health insurance. Any private health existence will be eliminated. Also, insurance premiums, co-payments, and deductibles, like I said before. Medicare for all insurance will cover many services that health plans now would omit. This includes hearing aids, eyeglasses, dental care, and long-term home-based care for the people that have disabilities. But it will make some huge changes to his healthcare finances in the United States today. As of now, we pay for our healthcare through the state taxes and federal taxes, as well as premiums and cash when we go to the doctors. Federal taxes will pay for the federal taxes will pay for the entire system under Medicare for all. Economists say that Medicare for all would cost around the same as the system today, government, employer, and individual spending all combined. So it will cost the same as we pay today in today's world. This would be a huge expansion of government spending, and this would require larger tax increases. On Bernie's release sheet, his proposal is centered on a large payroll tax that will be paid by medium and large companies, as well as families that earn more than $30,000 a year. This would include higher taxes on the people with high incomes. So people that make over 29,000 a year to $30,000 a year will not benefit from this. They will be paying taxes. But the people that are under this, it will be different. Every doctor and hospital in the country would accept this new health insurance. This doesn't mean high. This doesn't mean that you have to change your doctor either. Medicare for all would make you have to change your current health insurance. People that lose their private insurance will most likely get more generous government insurance. So they would get more government insurance that they would have got before. People who get their Medicare would see not much change. They would get Medicare, but with new benefits and fewer fees. The government controls the price of medication and medical services through regulation. So the universal health care lowers health care costs for the economy overall. Doctors will also only have to deal with one government agency. I think this would be nice for doctors to only have to deal with one government agency. It's just less work, honestly. This would eliminate the administrative cost of working with multiple private health insurance. Companies would save because they wouldn't need to hire staff to deal with health insurance rules. So not having to hire a lot of staff will save a lot of money. Coverage rules and billing procedures will be standardized. Instead of hospitals and doctors targeting wealthy clients and offering services they know that some can afford, but it will benefit them with a higher profit, they would be forced to provide the same service at a low cost. Also, universal health care leads to a healthier population. For example, preventive care lowers expensive emergency room usage. Before the Obamacare, 46% of people went to the emergency room because they had no choice, meaning they had no health insurance. This is big because people not being able to go to a primary doctor or whatever to get the help they need or being able to go to a doctor. Most people were just going to the emergency room because they didn't have any insurance like to cover them. This is a huge factor in the rising cost of Medicare. But in reality, the pros and cons of Medicare for all depends on your income. So like if you make a lot of money, then it probably won't benefit you. But like if you're like in the low, like, kind of middle class, then it will benefit you in ways. If you make less than $250,000, then additional tax will not affect you. If you make more than Medicare for all, you will most likely be a con for you. Also, it brings down the healthcare spending. Healthcare costs in the economy would likely lower through Medicare for all and increase quality care while facilitating more preventive care to keep from going to expensive emergency room visits. That's something that we all like to avoid and would avoid if we can. And like I said before, you could end up paying more if you make more than $250,000 a year. Medicare for all benefits would also include outpatient care, newborn care, and substance abuse services. So like places like rehab for people that need it, substance abuse and people that are getting abused, it will have classes, things for that, and it would be free basically. And I feel like this is a real big, really big deal.